In this video, we're going to be talking about underbites in kids and teenagers. Underbites are where the lower jaw is too far forward. It's on the other side of the upper teeth. There's issues with that. I'll talk about management and when the best time is to start correction of the underbites and what the results should look like. So let's go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about underbites for kids, teens. I'll also briefly talk about underbite management for adults as well. But today's discussion is going to be mostly on the left side, which is 7 to 10 years old. During that 7 to 10-year-old phase, we're looking at something called a reverse headgear, where we can bring the upper jaw forward. The teenager phase usually involves braces and rubber bands or another kind of appliance that goes with the braces. On the right-hand side, we have camouflage treatment, where you are not actually changing the jaw position, but you're just changing the teeth within the arch. And then, of course, on the bottom right, it is a jaw surgery that is usually done with an oral surgeon, where you actually change the position of the jaws. So all of these are part of the underbite treatment. I'll go into more specifics for the kids and teens right now. So what are underbites? Underbites are also called class 3. That's the classification where the jaw is too far forward. Class 1 is normal. Class 2 is where the lower jaw is too far back. Class 3 is where it's too far forward. So this class 3 underbites are when the jaw is too far forward of the upper maxilla. It usually occurs in about 5 to 10% of the population. And the severity depends on the family history. So this is something that does get passed down through the generations. So a brother, an uncle, an auntie, if somebody in the family has it, the kids have a chance to get it. Sometimes it skips generations, sometimes it skips cousins or brothers, but somewhere along the line, somebody within the family usually has it. So on the right side over here, we are looking at full underbites. So these are where the upper teeth are completely on the inside of the lower teeth. And so these are both full underbites. On the left side right over here, this is what we call an edge-to-edge underbite. The problem with the edge-to-edge underbites is, of course, the teeth are hitting directly on top of each other. So when teeth are hitting on top of each other, that causes teeth grinding, teeth wear, the teeth get smaller. So this is something you definitely want to fix. Both of them you definitely want to fix, but the one on the left, that's the one where the teeth are actually going to erode and get worn down. Here's a great example of an underbite treatment at the age of 9 years old. This patient has a reverse headgear and expander. You can see on the right photo here, this is what the reverse headgear looks like. It's on the front. It's different than the headgears that you've already seen that go on the back. That's for the opposite. That's a class 2 headgear. This is a class 3 underbite headgear where it's on the front. Of course, we're not wearing this to school. You're not showing your friends. This is worn 10 hours a day. So that's nighttime plus a few extra hours. It hooks onto these little arms that go on the expander, and it helps bring the jaw forward. So when we look at the top photo to the middle photo, you can see that the underbite is corrected for about 3 of the front 4 teeth. And then we put the braces on, and now the underbite is corrected for all the teeth. So this is a great example of an underbite treatment. The headgear and the expander is usually worn for somewhere between 6 to 10 months for this kind of correction, and then it's usually followed up with some braces. Here's another great example of a phase 1 expander with reverse headgear. This patient has a negative overlap of the front teeth. The teeth are on the wrong side. We use an expander and a headgear for 10 hours a day for about 8 to 10 months, and now we have positive overlap, and then we put the braces on, of course, to straighten out the teeth. This is a great example. On the right-hand side, you can see this actress. She's famous. Her name is Dakota Fanning. She was in a couple great movies. She wore a headgear at the Jay Leno show. She does have a little bit of an underbite. If you look at her on her later movies, you can actually see she has a very prominent lower chin. So she definitely needed to have the reverse headgear at her age. Here's another great example of the reverse headgear. This patient did have an older version of the expander. You can see it's a double arm version. It's a little bit wider than what I use today, but it works the same way. This patient had a mid-face deficiency. You can see the upper lip is a little bit inward, and then using the headgear, now the upper lip has support, and it looks really good in the corrected position. So this is a big profile change for this patient. He went from a negative overlap to having positive overlap, and the change was in the face, and it looks incredible. So this is a very good example of what the reverse headgear can do. Here's another example of what the reverse headgear can do. This patient is 8 years old, has a minor underbite. This is a little bit more than an edge-to-edge. but the front teeth are hitting on top of each other. So to avoid grinding and wearing down of those teeth, we used a headgear. We got more positive overlap. You might be looking at this photo on the right and thinking, oh my gosh, that's too much overlap, but that's incorrect. We want to get more overlap than is necessary because as these kids grow older, the underbite slowly comes on back. Because of the family history and the pubertal growth spurt, the lower jaw is going to grow a little farther forward. So we are aiming for 50, 60, 70% more correction than is necessary because that underbite will come back. It almost always does because of the family history is so strong. And usually what you do is during the phase 2, that's when you're going to do another round of underbite correction. And so that's what we'll do for this guy when he's about 12 to 14 years old. This is a great example of the teenage phase of underbite treatment using braces and rubber bands. This patient wore braces as a teenager, fixed the underbite, fixed the midline. You can see the midline is to his right and now it's centered by use of the rubber bands and the braces. This is an excellent example of how to fix the rubber band in that phase 2 or 12 to 16-year-old phase. That is usually the last time you can fix these underbites before we go into the adult range, which I'm going to right now. This is the adult underbite treatment with jaw surgery. You can actually see the jaw surgery in the x-rays. This patient had a 10 millimeter underbite. You can see quite a big underbite over here. This is corrected with jaw surgery. This is too big to fix with something like rubber bands or a reverse headgear. This patient has a very strong family history of an underbite. You can see in the profile photo, the change, how much nicer it looks. We have a more normal profile on the right photo here. The x-ray as well, you can see what was done. We had a jaw surgery. This is top and bottom. Upper jaws move forward, lower jaws move back. That's how you fix these jaw issues, especially the extreme ones just like this. This is a great example of an underbite with jaw surgery. This is the last example I'll go over, and this is a camouflage treatment. Camouflage means we are not changing the jaw position. So we're not changing the skeletal position of the upper and lower jaw. We are just moving the teeth. For this patient, we extracted one lower incisor to get positive overlap of the front teeth. So this patient does have an underbite. You can see that the teeth are hitting edge to edge. There's no way to get the underbite corrected, and this patient did not want to do a jaw surgery. So not everyone needs to do a jaw surgery just because you have an underbite. You can do something called camouflage treatment where you take out one tooth or two teeth. Sometimes you do something called IPR where you shave between the teeth if it's a very minor underbite. So this patient has 3 lower incisors on the right-hand side. On the left-hand side, there's 4. So we took out one of those and now we have positive overlap. So this is a great example of someone who didn't want to do jaw surgery, but wanted to fix the bite so they have positive overlap so they don't grind their teeth. So I love this example. It worked out extremely well. Let's do a quick recap of the underbite treatment between the ages of about 7 to 10 years old when the adult teeth are just coming in. That's after the 6-year-old molar. When usually the 7-year-old incisors start to come in, that's when we can actually start the treatment. That's done with the reverse headgear and expander. That's the upper left. Or right around the phase 2 or 12 years old to 17 years old. So this is during the pubertal growth spurt. We could do braces with rubber bands or braces with an appliance corrector that goes along with the braces. We can do it there during that time. A little bit older, if you still have an underbite and you want to make a profile change, then you would do a jaw surgery to get the bones to fit together. So that's a skeletal change. If you are not doing a skeletal change, you're not doing a jaw surgery, then you could do incisor extraction, you can do IPR, you can do 2 teeth extraction to get everything fitting together. This is not a jaw surgery. So each of these have its pros and cons to the treatment. So hopefully this video was helpful for anyone that has an underbite or if you know someone that has an underbite. Thank you guys for watching the underbite video. I did go over the underbite treatment by age, so hopefully it can help you determine what kind of treatment you need or a friend needs or your family member needs for you 5 to 10% of you out there. If you guys like this video, don't forget to like and subscribe. Check out my other Phase 1 videos on maxillary expansion and Phase 1 explained. If you guys have any questions, don't forget to drop a comment in the comment section, and I'll see you on the next one.